What role did the March of Dimes play in fighting polio? What role did the March of Dimes play in fighting polio? This organization was at the forefront of the battle against polio during the 1940s and 1950s, a time that many baby boomers remember vividly. Founded to combat this feared disease, the March of Dimes mobilized public support and funding for medical research aimed at understanding polio and preventing its spread. One of the most innovative strategies the March of Dimes used was encouraging people to donate just a dime. This simple yet effective fundraising approach allowed the organization to gather significant resources, even during tough economic times. With millions of dimes collected, the March of Dimes raised hundreds of thousands of dollars to support scientists working on polio research. A major achievement funded by the March of Dimes was the development of the Salk polio vaccine. Jonas Salk, a researcher backed by March of Dimes grants, transitioned from studying the poliovirus to creating a vaccine that brought hope to countless families. In 1954, a massive field trial tested the vaccine's safety and effectiveness with 1.8 million children, often referred to as polio pioneers. The results, announced in 1955, marked a turning point in public health. The vaccine led to a dramatic decline in polio cases, transforming a once common illness into a preventable condition. Beyond funding research, the March of Dimes also coordinated volunteers nationwide. These volunteers raised awareness and support for polio patients and their families. The organization recognized that polio was not just a medical issue but also a social one. They highlighted the need for equitable care across different communities, ensuring that everyone had access to the help they needed. The impact of the March of Dimes during the 1950s is remembered fondly. It represents a time when collective action, scientific progress, and hope came together to defeat a disease that had cast a long shadow over childhood. The success against polio helped build public trust in vaccines and public health initiatives, setting a precedent for future efforts to combat other diseases. In practical terms, the March of Dimes work meant that children who might have faced paralysis or death from polio could now look forward to a healthier future. The organization also established a model for how public fundraising and medical research could work together to overcome significant health challenges. The March of Dimes played an essential role in ending the polio epidemic by funding critical research and supporting the development and testing of the Salk vaccine. Their efforts in mobilizing volunteers and raising public awareness remains as a defining chapter of the 1950s, remembered for its spirit of hope and community action.